Welcome back. The World Health Organization is set to hold an emergency meeting later today to discuss the Ebola outbreak on the African continent. So far, there have been at least 130 deaths and more than 500 suspected cases linked to the outbreak. Among the latest patients is American doctor Peter Stafford. He's been working with a medical missionary organization in the DRC. The CDC says he's been taken to Germany for treatment. The Trump administration is now banning non-U.S. passport holders who've been to the DRC, Uganda, or South Sudan in the past 3 weeks from entering the U.S. We're now joined by Nyathi. He's a disaster risk management coordinator for the International Federation of the Red Cross, and he joins us from Kinshasa there in the Democratic Republic of the Congo. Good morning and welcome. Explain to us what you're seeing firsthand on the ground there and how serious the situation has become.
As you rightly said, the situation is getting out of hand. DRC declared their 17th Ebola outbreak on the 15th, and we were talking about 250 suspected cases on the 15th and about 80 deaths. These numbers have doubled up as I'm speaking right now, which makes this outbreak a bit complex, given that definitely it's a rare strain and there is no approved vaccine or treatment whatsoever. On the ground, I would say the situation is evolving extremely quickly, and we are seeing quite a lot of suspected cases, and of course there is loss of life. My organization, the IFRC, together with the DRC Red Cross, is involved on the ground. And we are actually working on, we have already mobilized about 300 volunteers that are part of this community. And remember, the Red Cross is a local organization, and which means they are part of this community. Right. They know each other within the community, and we are busy with safe and dignified burials and, of course, surveillance.
How personally afraid are you that this may be bigger than it seems? Because it spread quite quickly, wasn't identified until lately. And have you seen an impact from the U.S. withdrawing from the World Health Organization and making cuts to USAID and other agencies? Have you seen the impact of that yet?
Look, this outbreak, as I said, as I've mentioned, we're all aware that there is no approved vaccines. We're all aware that there is no treatment whatsoever. So everybody is afraid, but we are humanitarians. Our job is to make sure that we assist the government, reach out to the communities and make sure that we coordinate all our efforts with other partners. It's not only the US that had humanitarian aid cuts. I would say all partners that have been working with reduced their funding. And this is the time for them to reconsider, because I feel that the more we accept the fact that when surveillance weakens, the outbreak grows in silence. And for us to break that, we will need more support so that we are able to reach out to the most vulnerable communities that are affected as we speak.
Yeah, I'm sure everyone there appreciates you working through your fear in order to help so many others. Admiral Nyathi, we appreciate you joining us from Kinshasa this morning. Thanks for your time.
Thank you for having me.